navigating the healthcare system can be quite a challenge. Even now, so I still feel quite invisible and sometimes overwhelmed. I guess when I was first diagnosed, the term vasculitis or autoimmune disease is very strange.
I first started my journey as a caregiver. I feel really very lost and overwhelmed because when my husband was first diagnosed with Parkinson, the doctor just says that there's no cure. I decided to join SPAN because I wanted to share with people with caregivers so that their experience will be easier, better than the next. Every individual is different. So by hearing from them, their side of the story is unique, so that their care can be really catered to their needs.
Ultimately, we are the experts of our own diseases, having lived with it for many decades and probably for the rest of our life. I've run a support group for autoimmune diseases for about a decade now. It's called Autoimmune Diseases Singapore. And I think how it ties in with the work at SPAN is that because we have all these collective voices and experiences, it also widens my own perspective. I don't know a lot about other patients, but because they all come to this group and it's a common platform to share their concerns, their anxieties, the challenges that they face in the healthcare system. So I think that's how it can be a collective voice for everyone.
I joined SPAN because I have Duchenne muscular dystrophy, a rare disease, and I realized that there's not a lot of very little awareness of rare diseases in Singapore. So I feel that being part of SPAN will enable me to spread more awareness and also enable more patients with rare diseases to try like me. I think when we deliver healthcare services, we must think about the end user. Because these are usually patients. When we communicate more with the patients and learn about what their needs are, also what are the struggles, what are the challenges, we were able to do better services.
So an important attribute of being a SPAN member is also the concept of partnership to co-design and co-create solutions for a better healthcare system. 2 years ago, we established the Patient and Healthcare Team Care Pledge. It's a common platform where both the patient and the healthcare professional pledge to keep a safe healthcare environment for everyone.
For me, it's important for us to have dedication, and that is beyond just passion, because passion can die out very fast. For me, dedication is more sustainable, and building our commitment, it also shows that the heart is there in what we get the work that we do. One thing that I feel very proud of is also the fact that I've also been on the MOH's Agency for Caregiver Activities, or ACE patient review team. So I help to review patient fact sheets before they go out to the public, so making sure that they are end user friendly. For us to build a more career inclusive society, it must start with the healthcare system first, because that is where we experience person-to-person connection and receive the care that we need to live.
All the proud moments has happened quite recently. So SPAN is a finalist at the President's Volunteerism and Philanthropy Awards. So I think that really shows the recognition and our effort.
I would like to see the ecosystem will be one that care for the patient, not just the illness, because empathy is one that turns care into healing.
For me, as our population ages, it's important that we have more patient involvement and also have our voices contributing to the policies that we receive. What I want to say is not just more support, but more participations for patients and caregivers, so that we can get to also have a stake and have a seat at the table.